this is a decision of virtually no choice.
As respiratory viruses continue to surge in Calgary, Alberta Health Services is redeploying staff from a pediatric hospice to the Alberta Children's Hospital. Roughly 65 AHS employees from the hospice and outpatient clinics will be redeployed to the Children's Hospital. AHS says they plan to discharge all respite patients at the Flames Rotary House by December 6th. Other Rotary services, including palliative and end-of-life care, will be temporarily relocated to the Children's Hospital.
There's a whole lot of uncertainty in terms of if I'm being reassigned, redeployed, how long is that going to be? What kind of orientation am I going to get?
The province is experiencing high volumes of patients with COVID, influenza, and respiratory syncytial virus. Heather Smith is the president with United Nurses of Alberta. While she recommends masking, hand washing, and social distancing, she says the province isn't doing enough.
We are a province where that is, from my perspective, discouraged when it is appropriate protections to be taking for seniors and children.
Alberta Minister of Health Jason Copping is meanwhile hoping that the worst has already come.
What we're seeing right now is it appears we may be at the peak and then we'll come back down. So that's the short term. Longer term, we're continuing to add capacity.
But Smith says more beds need additional staffing measures.
But you can't open beds if you don't have the people to actually look after patients in those beds. And that's, of course, is not new. It's a huge issue, but it's a very basic need.
Margaret Fullerton is the Senior Operating Officer with the Alberta Children's Hospital. She says 10 additional newly hired nurses are set to start in January. While capacity rates are consistently fluctuating, they're also consistently high.
And what happens too with these surges is, we'll have times when we're at 120% capacity and other times when we're at 100% capacity.
In Calgary, Tate Laycraft, City News.